Hello, my name is Gigi Robinson. I am a full-time content creator, author, public speaker, and as I like to say, creatorpreneur. I focus on a lot of different things, but I originally got my start in the health advocacy world because of my lived patient experience dealing with hypermobile Ehlers-Danlos syndrome, endometriosis, chronic migraines, and chronic fatigue and pain. So I originally got my endometriosis diagnosis just almost a little less than 3 years ago. So that's the most recent one. But if we're going all the way back to my first diagnosis of hypermobile Ehlers-Danlos syndrome, I was constantly getting injured. And luckily, I lived in New York City and I had access to some really amazing doctors at New York Presbyterian, Cornell, and HSS. And one of the fellows in the emergency room, one of the times I got injured, was like, I think you really need to go and see this one pediatric orthopedist at HSS. So I went and she says, yeah, I think you meet all the markers for EDS. Go see this geneticist at Cornell. So I went and saw the geneticist. She says, yes, checks out. And if you know, or if you don't know, for hypermobile Ehlers-Danlos, there's supposedly no genetic test for that. It's only based on a series of like things that you can do physically and or things your parents can do physically to kind of see those markers. I'm not sure what has changed in the past 15 years in terms of getting that diagnosis, but at least to my knowledge, it's based on the like hypermobility scale. It has a specific name, but I'm not sure what it's called. And I guess I fell into it. And so that became the original source of my chronic pain and fatigue. But as I got older and through my adolescence and through my teenage years, I honestly started to feel a lot more chronic pain, chronic fatigue, cyclical pain, and no one really thought of endometriosis. It actually wasn't until I had graduated college, which I was struggling immensely with to deal with my health and manage my pain during college. It wasn't until COVID happened and I came back to New York City from LA where I was in school. And I went to this specific pain management doctor at Columbia and I went through a bunch of different treatments with her, steroid injections, acupuncture, so on and so forth, and medication and massage therapy. And all of a sudden, I mean, I say all of a sudden, but after 2 years of trying to figure out what was going on, I ultimately decided, well, she recommended and I decided to move forward with the diagnostic laparoscopy and to see if I had endometriosis. And I actually took a year and a half to even schedule the surgery because it is really this challenging thing to grapple with of, do I want to have a surgery where there's a 10% chance I have this? I mean, how likely can that really be? But if you're in the room of 100 people, you know, there's 10 women there that probably struggle with it. And they're actually supposedly finding that more people struggle with endometriosis than they even talk about or that is even researched or polled. So it's probably more. And I went forward with it. And, you know, I had all the symptoms, stomach problems that were unexplained by the GI doctor. You know, everything looks fine for the most part. Maybe you have a little stomach acid issue, but is what it is. They couldn't really figure out the cause of my migraines, which again, were very cyclical and with aura. So very aligned with endometriosis symptoms. Horrible, horrible lower back pain. And ultimately getting that diagnosis, I think, really shaped the way that I was able to start healing. I think the journey was you need to get this exploratory surgery, period. And I mean, nobody was forcing me, but it was definitely you should get this surgery to see if, you know, there's any way that you have this, because we think that in doing this surgery, there's a high likelihood that you do have endo. And if you have endo, then we can figure out a treatment plan for you. And ultimately, the doctors are there to help you find a treatment plan. That's the caveat is, a lot of times doctors are not necessarily trying to understand the root cause, and they don't even understand the root cause of endometriosis. They just understand that it happens. And so how can we alleviate some of those symptoms is really what we were focused on. And for me, that included surgery. So I saw 3 different doctors within that year and a half, and I just made the decision to go with one of the doctors that I saw. Same way for my breast reduction, I saw 3 different doctors. I think it's very important to see at least 2 doctors and get second opinions, get opinions from your PCP about it, see what other people on your care team are thinking. Because if you just go to one doctor and they're like, yeah, you should get the surgery, you move forward with it, and you don't really consult your other care team, which a lot of people living with EDS have multiple different doctors. I mean, I've seen everything under the sun for the most part, from a rheumatologist, an endocrinologist, to an anesthesiologist, gastroenterologist, neurologist. I mean, I've seen all of these different kinds of doctors to manage the EDS. And when I would see these doctors as I was deciding if I wanted to have surgery or not, they all said, yeah, I think this is a good next step. Because at that point, I had already been through a number of other tests that came back as normal. And when they come back as normal, it's almost like so defeating. But I decided to just push myself to continue to find an answer. And that was honestly the journey. And I mean, I think there's also a lot of uncertainty when you get the surgery. There's either a yes or no answer. I mean, there really isn't anything in between. I mean, I don't remember exactly, but I think it's a 2 to 4 hour surgery. I'm not 100% sure. I went in early and was out by 4 o'clock, I think, and maybe earlier. And essentially the endosurgery, it's a very common procedure, a laparoscopic surgery. So they make 4 or 5 keyhole incisions in your abdomen, and then they supposedly fill your cavity up with gas so they can look around. And then they excise or do the ablation on certain areas where they see the endometriosis, and then they stitch you up, and then they send you home. And that's how it works. Again, I'm not a doctor, so I can't speak to how it's actually done, but I believe they also use different kinds of tools and whatnot. I mean, their hands are not actually cutting. They're using some kind of robotic thing. Yeah, that's what I know about that. And I think the recovery for that surgery was really challenging. It was definitely a very painful experience. I think it took me about eight weeks to start feeling better. And it was a process. It was a journey. And honestly, also getting used to the aesthetics afterwards and how your body is, and depending on where they've excised different parts of the endometriosis, for example, on a bowel or a bladder, other things will be affected, like drinking caffeine, drinking soda, anything sweet, anything acidic. It's almost like a lemon being squeezed on an open wound. So it's internal and it's very painful. And that's something I think not a lot of people talk about when it comes to side effects of the surgery, but it was a challenge for me. And also the gas leaving your body is like the worst pain ever. It's not the incisions themselves. It's the fact that it's internal. You know, they've moved things around internally and that kind of hurts a little, but really that gas leaving your body. Yeah, it was extremely painful. And I think, I mean, I've also gotten a breast reduction, and I can tell you the endosurgery was so much more painful of a recovery. Even though the breast reduction took longer for the wounds to close because of the hypermobile EDS and how my skin heals, for some people, their skin heals like right away. But for me with the EDS, it just took a couple months, but it wasn't painful versus the endosurgery is a painful recovery. because of that surgery, I am now able to feel endorphins when I exercise, which is something I have talked about a lot. I have experienced a lot of chronic pain and fatigue. I used to not understand why people exercised because it was so painful. And after that surgery, all of a sudden I'm able to exercise and feel endorphins. And I'm like, what is this? Like, this is what all you people are feeling this whole time. And just sticking to that and knowing that if I eat gluten, I'm going to feel inflamed. If I drink caffeine, my bladder might hurt. If I drink soda, my bladder might hurt. If I eat something acidic, also my bladder and bowel might hurt. And just also eating, I was actually vegan and gluten-free for the first 2 years after surgery. I only recently started eating protein again, but eating on a vegan diet for the time being was very helpful because it's less challenging for your digestive system to break down plant protein and plant-based foods because that's just how your gut works. Apparently, at least this is what I've been told, plants stay in your system for about 24 hours versus animal protein can stay in your system for up to a week. So in terms of the digestion, breaking things down, it was less harsh on my digestive system, which in turn I think helped my healing process. Yeah, it was a trial and error. I think, there's a lot of stuff out there on the internet, to put it lightly, that can be very misleading and kind of fearmonger. So that is my story of how I got the surgery.